Great, good afternoon and welcome to our Career Connections monthly webinar. Today's topic is Home Health Aide Training, and I am so pleased to welcome our partners from Help at Home Healthcare. My name is Lori Gentile, and I'm the Director of Client Services for the Women's Resource Center, and I will be your host today. You may have noticed that all the lines are muted, but we still do want to hear from you. If you'd like to ask a question, please find the Q&A box. It's usually at the bottom of your screen, and then type in your questions. And then at the end, we'll take as many questions as we have time for. Before I introduce the presenters, though, I just want to give you a little bit of information about the Women's Resource Center. The Women's Resource Center has been empowering women in Manatee and Sarasota counties since 1979. We offer our programs and services either at no cost or at very low cost. And we offer mental health counseling, career services, educational scholarships and programs, legal and financial consultation and education, and wellness programs. And now with our centers mostly closed, our programs are offered, almost all of them remotely. So we have 3 centers, Manatee on Manatee Avenue West, Sarasota on Tuttle Avenue, and then in Venice on 41 South. And right now, as I mentioned, our centers are closed, but we are open Wednesdays from 11 to 3 to take donations and for people to visit our career closet. I'm having a little trouble with my mouse, so excuse me. Not sure what the problem is. It's very, okay, here we go. We also have what we call our unique boutique, and that's an upscale resale clothing center, which accounts for part of our revenue and that pays for part of our programming. And the unique boutique is open now from Tuesdays to Fridays from 11 to 4. And that's also in Bradenton on Main Street. So today, since this is a career-focused webinar, I'm just going to talk a little bit about our career services. We offer, and our career coaching is also remote, either by telephone or by Zoom. We offer career coaching that is one-on-one career support. So our career coaches can take you on your entire career journey, or they will meet you exactly where you are along that spectrum. So if you're looking to find a new career, they can help you through career explorations. But if you already know what you're going to do, they can help you with your career search, writing resumes, and doing practice interviews. Our career centers, which are currently closed, but we have career centers in all 3 of our centers. And in the career centers, we have folks who can help you, on the fly. Career coaching is by appointment only, but they can help you with resumes. There's computer tutoring. They can help you with your job search if you need some help navigating some of the online search sites such as Indeed. We also have career closets. I mentioned that before. Career closets, women can come in and get clothing, whether it's for a job or a job interview or just because they're in need of clothing. And then we have different workshops. This is one of our workshops, the Career Connections, where the Career Connections program matches women in the community with either current open job opportunities, or as you'll see today, with educational opportunities that can help prepare you for a career. So one other thing I want to point out before we get started is on our website. If you log into mywrc.org, there's a big button on the front and it says COVID-19 resources. And as soon as we closed our centers back in March, we started digging and collecting all different kinds of resources to help our community through the COVID pandemic. And the one thing I wanted to point out today is at the top, you'll see there's clickable links, and there's a whole section on employment resources, excuse me. And that also includes local companies that are currently hiring through the pandemic. So I encourage you to take a look. And then if you'd like more information, our phone number is 941-256-9721. Our website is www.mywrc.org. And let me just stop sharing here so our guests can share their presentation. And now it is my pleasure to introduce to you our speakers for today, Donna Roberto. Donna is a registered nurse, clinical supervisor, and an educator. And Amy Garrison, who is the HR recruitment coordinator from Help at Home Healthcare. Thanks for joining.
Thank you. Thank you. Hi, I'm Donna.
And I'm Amy. I'm the HR recruitment coordinator.
So we're going to begin the presentation. I'm going to take you through the process of the program that Help at Home is now offering. So Help at Home is a private home care agency. Okay. And if you're interested in becoming a home health aide with Help at Home, this is a great opportunity, and we're very excited about it. We started the home health aide training program in July, and we've had students, and we will now have graduates who are presently working. So we're very excited about it, and I'd like to just take you through the program. So Help at Home is offering a free training program, and you do get paid while you're learning. We're paying $10 an hour during class while you're learning. It's 40 hours of training, and the training is according to the guidelines from the state of Florida. So the 40 hours include the requirements from the state. And I am the instructor for the class. And during class, we have a PowerPoint, so we do some lecture. We also have a clinical where I have all the equipment. I have a hospital bed, I have a mannequin, I have all the equipment. So we're able to practice all the skills of becoming a home health aide, along with the PowerPoint presentation and DVDs on all of the topics. So once you're done with the 40 hours of training, you will then move on and graduate, and you'll be able to earn $13 an hour as a home health aide. Okay. While you're working, once you graduated, we do offer what's called PRN shift work, which allows you a very flexible schedule. Our clients sign on with our home care agency, and some of them may need help a few times a week. Some of them may need 24-hour care. So we have different shifts which are available for the home health aides to work. So it allows you to choose your schedule. You can work on the weekends, you can work evenings, you can work at night, you can work during the day. So it's very flexible. So that's what's considered PRN shift work. We offer employment in Sarasota and Manatee counties. So I'm just going to bring you through what home health care is, and this is just a brief overview if you don't know about home care. Home care is really a great thing. It allows people to remain in their home, and people, when they're sick or as they age, some people would rather stay in their home than go to a facility or a rehab or a nursing home. So as home health care, we're able to do that for clients. I have been in home health care about 30 years, and it is the best thing. It's very rewarding. We're able to keep people at home. Individuals are unique. Each client is unique, and they require different levels of care. So our main goals of home care are to provide comfort for the client, keep them safe in their home, and have them become as independent as possible. And that's so important for people to keep their independence and be safe within their home environment. Help at Home provides many types of care. Our class focuses on the home health aide level, but I just would like to go over the type of services that we also provide. We provide the non-skilled level, and we can provide, like I said, 24 hours of care for people 7 days a week in their home. We provide homemakers, companions, sitters, and drivers. That's one of our levels. That's non-skilled. And we also provide the level Home Health Aide CNA, which where the class, is what the class is all about. So we also provide skilled care. We can provide nursing, licensed practical nurses. We can provide registered nurses in the home. We can provide therapies, physical therapy, occupational therapy, speech therapy, social work services. We also can provide massage therapy in the home. Now, the skilled services are ordered by a physician, the skilled services. The non-skilled services, we do not need an order from the physician. So we can provide homemakers and home health aides without an order from a physician. We also staff in facilities. Our staff will go into a facility, like a rehab or a hospital, and provide the care there for a client, if that's what the client is requesting. And we provide 8-hour shifts in facilities. We provide 12-hour shifts, and we provide all types of care: home health aide, licensed practical nurse, registered nurse. So we serve quite a large population. Our clients are the elderly. We provide care to moms and newborns. We also provide care to clients who may have had some type of reconstructive or cosmetic surgery, and they may need us for a short period of time after surgery. And we also work with clients with terminal illnesses, chronic illnesses such as diabetes, cancer, high blood pressure. So we are dealing with clients with illnesses also. We also provide care to Alzheimer's and dementia clients in their home, clients with memory loss, and they're able to stay in their home with our help. During class, you'll learn about all these different conditions, illnesses. We also do an extensive training during class on Alzheimer's and dementia. We also provide care at home, something called RN care management, where we provide an RN who acts as the surrogate for the family who may be out of state. And this RN manages the entire care of this client, doctor's appointment, medications, and they're available 24 hours a day, 7 days a week to that client. We also provide licensed practical nurses to set up medication pre-planners in the home. Some clients can't take their own medications. They can't set up their own medications, maybe because of their illness, maybe because of memory. So we can provide that type of service in the home. We also provide pet care and also travel assistance out of the area, out of the state, and sometimes out of the country. Not as much right now with COVID, but we do, if our client needs to relocate, we will provide a caregiver to go with them and get them set up in their new environment, and then that caregiver will return back home. So our class is home health aide training, so I'd just like to talk about the role of a home health aide. So what does a home health aide do? A home health aide assists clients with their personal care, bathing, maybe help into the bathroom, walking, just with their personal care. Then they can also assist clients with activities of their daily living, shopping, maybe some light housekeeping, meal preparation. Those would be activities of daily living. We also provide companionship to that client. Maybe they're alone and we're their companion. We maintain a clean, safe environment for the client. We always want to make sure our clients are safe in their home. We can also accompany them to doctor's appointments or maybe outings. And the role of a home health aide is to report to an RN case manager. So every one of our clients has what is called an RN case manager. So even though you're in the home with that client and you're providing them care, you always have access by phone 24 hours a day, 7 days a week to an RN who manages that case and who oversees the entire case. Sometimes that RN will make a visit into the home with you, but is always available to you. So some of the qualities of a home health aide: punctuality, so important to be on time, to be reliable, to be accountable, to be flexible. Honesty is important. That's an important quality. To be conscientious and to be courteous and respectful of clients and also other coworkers, because you'll also be dealing with other coworkers at times in the home. Good communication skills, empathy, having a caring way for your clients, willingness to learn. There's always something new to learn in healthcare. I've been in healthcare a long time and I'm always learning. So the willingness to learn, and also the ability to set professional boundaries, because you are in the home. You may be visiting that client 3 times a week, and you may be with that client for months, sometimes even years, and you develop a relationship with that client, and you need to know that you need to have those professional boundaries with that client. So what are some of the home health aide tasks? What does a home health aide do? And this is a very busy slide. There's a lot of information on it. I'm going to touch on some of the areas, but the class goes over each area extensively, and you will learn the different skills. But a home health aide can assist with personal care, assist a client with transfers and walking, do some light housekeeping. Maybe the client has a dressing on, so you're able to, if that dressing is falling off, you're able to reinforce that dressing. You can assist the client to use the bathroom. Maybe they use a bedpan or a urinal. Some of our clients have catheters, which is a special tube that allows them to urinate, and you learn how to take care of that tube and how to take care of the catheter bag. Also how to collect specimens. We do sometimes have clients with colostomies, which we'll learn about in class, your empty colostomy bags. You can assist with all types of equipment, hospital beds, walkers, wheelchairs, canes. You can also assist the client with exercises, special exercises. Some clients are on special diets, so you will be assisting and preparing with the special diet, or you may just be preparing, a regular meal for your clients. Also, vital signs, temperature, pulse, respirations, blood pressures. A home health aide can perform that. You also can assist with the client with administration of medications, and that's something you learn in our home health aide class. Now, there are certain rules. Home health aides cannot perform certain tasks. They're not allowed to change a dressing, not allowed to give an enema or give a suppository, not allowed to do specific procedures with catheters or feeding tubes. Some people have feeding tubes, and there's certain requirements home health aide cannot do. Cannot give injections and cannot administer the medications. You can assist with the medications, but not administer them. You're also not allowed to apply a hot pack or cut a client's nails. Also, you cannot provide a tracheostomy care, and you'll learn about tracheostomy care. Tracheostomy is a special tube that helps the client breathe. You cannot do the client's banking or assist with check writing. And also, you're not allowed to do heavy housework. You're able to do light housekeeping. And all of these things will be covered in our home health aide class. Okay, so what will you learn? Okay, like I had said in the beginning, the training meets the Florida state requirements of 40 hours of instruction. The class includes hands-on demonstration. We practice classroom instruction, lecture, DVDs, and there's many areas that we cover. And some of the training, you'll learn the role and responsibilities, which I briefly went over, but we'll learn those in detail. The role and responsibilities of a home health aide. How to communicate, communication skills, very important. How to communicate with people, with clients, with family members. You'll learn techniques to provide personal care and hygiene to clients. Also learn transfers, mobility, how clients move. Different clients can move different ways. Some clients cannot get out of bed. So you'll learn how to use different equipment, of how to get a client up out of bed into a chair. We'll practice vital signs, learn how to do vital signs, temperatures, blood pressures, pulse, respirations. Also assisting with medications. We'll learn nutrition, which includes food preparation. I will instruct on the different diets. Also very important, basic infection control, hand washing, how to clean surfaces, when to wear gloves, when not to wear gloves, how to maintain a clean, safe environment for your client. You'll also learn about observation, what to report to your nurse, and how to document that as a home health aide. So that's an overview of the class. Like I said, it's 40 hours, and we will specifically get into all those areas. The class size is limited to 4 people so that we can social distance and wear masks and also have the time to practice the skills. So now I'll turn the presentation over to Amy so she can talk about the hiring process. Thank you.
Okay, so what does the hire process look like? So all interested applicants will need to be interviewed for a spot in the class, and Donna does all of the interviewing for the class. Once you enter into the class and you've been interviewed and it's approved, and you enter in and you're enrolled, you will be required to sign a contract with us that after you graduate from the class, that you will work for us for 6 months at least 20 hours a week. Doesn't mean that you won't get up to, you can get up to 40 hours a week, but it is required that you work up to 20 hours a week and 1 weekend a month, okay? So if that contract is breached during that 6-month period, you will have to pay Help at Home the cost of the class, okay? Just want everybody to be aware of that, so that we're transparent on that. So after you go through the interview process, you'll be sent the application documents to complete. You'll be sent a link to complete an assessment and asked to provide us with certain documents that are needed. And then prior to the class, you must complete all new hire paperwork for us, okay? Classes will be held on Tuesdays, Wednesdays, and Thursdays for 2 weeks, and it's 40 hours in total. And so the hours of the class are 8:30 a.m. to 3:30 p.m. So be sure to be prompt. We want to make sure that we're starting the class, you know, on time. And our next classes begin September 1st through the 10th, and then the second is September 22nd through October 1st. Now we will continue to move on. Those are the classes that we have set, but we will have classes in October and November and December. Okay. Okay, so what will you need? What documents will you need? You need a current and active driver's license, okay? Social Security card, current proof of auto insurance in your name, and you must have access to your own automobile during all shifts. And the reason for this is because you will be taking clients occasionally to appointments, or you may be going grocery shopping for them, so you must have auto insurance, and you must have your own automobile when you go to the client's home, okay? You will be required to be fingerprinted. It's a level 2 background check, and Help at Home will set you up in the system to be fingerprinted. The estimated cost of fingerprinting is $85 to $95. CPR certification, you will need that, and the estimated cost of that is $40 to $50. And last but not least, a TB test or a chest x-ray. We do have a nurse on site that can do a TB screen for you. If a chest x-ray is needed, we will send you to have the chest x-ray done. But I just want to let you know that when you do pay for these, we do reimburse you for the cost of each of these things. If for some reason that you don't have the funding to take care of this at this time, we can help you with that, okay? Personal protective equipment. So during the class, we'll be social distancing, and as you enter the classroom, we'll be taking temperatures. You'll always be wearing masks, and you'll use hand sanitizer. Now, masks and gloves and hand sanitizer will be provided during the HHA training class. And of course, after graduation, when you're caring for our clients, we will provide all of that to you. And last but not least, we'd love to hear from you. Okay, so if you are interested in this class, please give me a call. My number is 941-388-3117, and we would love to hear from you and begin the process.
Terrific. Thanks so much. For those of you who joined late, obviously the lines are muted, but we'd love to answer any questions that anyone has. There is a box which usually sits at the bottom of your screen. It says Q&A. If you have a question, just type it into the Q&A box. Okay. Very informative. Have a great program. Thank you for your time.
Thank you.
Where is the location of the training?
The location of the training is here at Help at Home Homecare, and that's here in Sarasota, and it's 7100 Beneva Road.
Okay. And if you already have had your fingerprinting done, do you need to do it again?
No, fingerprinting lasts for 5 years. So level 2 background check will last for 5 years. So if it has not expired, and you will know when it expires, then you'll be all set. The same with the CPR. If you have CPR, you're not required to do it again.
Okay.
Just with the CPR in the next probably 2 months, we'll be able to do the CPR on site here, and I'll be doing the CPR once I'm trained, so you won't even have to go out for that. So it'll be done.
Okay.
It will be probably done as an add-on to the class. It won't be part of the 40 hours, but it will be available here also.
And then you said there's 4 spots open immediately, but then there's 4 more and then 4 more continuing on?
Correct.
Yes.
Okay.
We tried to put the dates ahead of time and get at least 2 sets of dates out for each as we're moving along. So yes, if you're not in the next class, you'd be put on the waiting list for the next class. And then if for some reason we get a cancellation, we'll offer the class to you, to the person who's on the waiting list.
Okay. Okay, I don't see any other questions. Oh, are the interviews in person?
The interview with me is either in person or I can FaceTime, and I'm pretty flexible with when I interview with time. So the FaceTime interviews make it very flexible, where we could pick a time that works for both of us.
Okay. If I had an LPN, but I don't have a license to work in Florida, will you treat me as a non-skilled one?
Yes.
Yeah.
Yes. Mm-hmm.
Okay.
We have done that in the past. We actually had an RN who let their license expire from another state, and they haven't worked in a few years, and they, were retired, and they decided to come out of retirement, and they're going to be in the class.
Okay. Let's see. I don't have a valid driver's license. It just expired, and I need to take the test again. However, I've called and made an appointment, but it may be another month. I wonder if COVID has to do with that.
It probably does. Now, we do require that you do have a valid driver's license, because we do check motor vehicle records as well. Before we hire you on, we check background check, we check motor vehicle records. But I understand that they are starting to loosen up with the DMV requirements and everything. So they're starting to book appointments. We actually had somebody that just got an appointment. So just keep reaching out to them and follow up with them.
Yeah, everything's a little bit more difficult.
Yes, it's a little more difficult now.
And then is it okay if I reach back out when I'm all straightened out with that? So would she call you?
Yes, she would call me. Yes.
Okay. All righty.
And even if they feel that they can't be in any of the classes in September, you are missing something, or maybe you can't, you don't have the availability for the class at this time, you are welcome to reach out in the month of October or November and say, I'm interested in the class. You know, I viewed the webinar, but I just wasn't available during the month of September. Please feel free to reach out at any time.
Good, good. So I don't see, oh wait, here comes one. I have taken a HHA class, but the company didn't have a client. So can I do it with your agency?
Yes.
Yes,
You could.
definitely.
Yes.
Mhm.
Okay. Okay. Looks good. Well, thank you so much. That was a great presentation.
Thank you.
And oh yeah, they said, okay, they'll be in touch. Thank you. Thank you. Lots of thank
Great.
Thank you.
you.
We so appreciate it.
Yes.
Oh yeah, it's great. So just a reminder, you know, if you have any questions for the Women's Resource Center, or if you'd like to set up an appointment with a career coach or any of our services, our phone number again is 941-366-1700. And also this, we will package up, this webinar is being recorded, we'll package it up and send it out along with both presentations and a little survey. So if you would just take, it's only 4 or 5 questions, I think, if you wouldn't mind, that helps us improve our programming. So thanks again. It was great to be with you guys today.
Yeah, we appreciate it.
Yes, thanks for having
Thank
us.
you. Okay,
Hear
be
from
well,
everybody.
everybody.
Okay,
Bye.
bye-bye.
Bye.
Bye.
Bye.